Prevention Month and our flag raising ceremony. I'm Mark O'Brien, the Erie County Commissioner of Mental Health. We have a robust program today with some distinguished speakers and permanent response to a temporary situation. Most who seriously contemplate suicide really want to end their pain. Then they see ending their life as a way to do it. That pain and despair can have identifiable external causes or can have none at all, with severe, persistent depression being a struggle. Depression is treatable, help is available. Understanding that can bring hope and connection. According to the American Foundation for Suicide Prevention, suicide is the 11th leading cause of death among adults. You will hear more statistics from our speakers today. The Suicide Prevention Coalition is a partnership of county government, local mental health agencies, advocates, family members, and survivors coming together to help light the way out of darkness. You will hear more from them today on the important work that they do. First, it is my honor to introduce County Executive Mark Poloncarz, who has been unswerving in his leadership and support on issues related to mental and behavioral health, including both suicide prevention and the battle against opioid addiction and overdose fatalities. Mr. County Executive.
Thanks, Mark, for your kind words, and good morning to all as we join here annually to remind everybody that the act of one, which is to alleviate their pain, can create so much pain for other people. I want to thank the Suicide Coalition, Prevention Coalition, for their continued advocacy of this very important issue. Each week I receive reports from the Department of Health on various issues, and one of them are the number of suicides that we have in our community in the prior week. And unfortunately, there is rarely a week where we at least don't have one. And that is something that is very distressing, because it reminds each and every one of us that the work must continue and go on to remind, as Commissioner O'Brien said, that the individual is just trying to alleviate the pain they have at their moment. Unfortunately, the act that they take is the final act. It does alleviate their pain, but it creates pain for so many other people. I know that myself from a very dear friend who committed suicide a number of years ago, that his act, which I think was just out of sheer desperation in a moment of crisis, created pain for so many other people. And that's what we want to remind everybody, is that it will get better. There will be brighter days ahead. What seems like the end of the world at that moment is just one little step that you can overcome, especially with the great people that are standing behind us here, who are here to help. There are people who care. There are people to help. That's why the 988 number is there, so that if you are in a crisis situation, no matter where you are, you call 988 and someone will answer that phone to help you get through that situation, because brighter days do lie ahead. And I do want to thank each and every one of the members of the Prevention Coalition that are here. This is not just one day for them. This is not just coming out here to raise the flag of hope one day. This is every day, 365 days a year, unless of course it's a leap year, then we add one more day of work. So thank you to each and every one of them for your good work on what is really a very important topic. Finally, I really don't know any family or people who in some ways been touched by suicide, whether it's a family member themselves, a friend. And it's just an example of how unfortunate this is in our society. So to all, if you are considering this final act, it is an act that will cause so much pain to other people, more pain in some ways than what you're dealing with at that moment, that just remember, people care about you. People love you. And as a society, if you are in a crisis situation, do not call 988. Talk to somebody who cares all every day and ensuring a better life for each and every one of us in our community. And it's my pleasure to introduce our leader, the captain of our Department of Health, Commissioner Dr. Gale Burstein.
Good morning. So each year we assemble outside the Rath Building dedicated for people to connect with trained, compassionate mental health professionals to talk through mental health crises, substance use disorders, and suicidal thoughts. While I'm talking here, I want you to all take out your phones like I am and then add 988 into your contact information. Passionate mental health care provider on the other side of the line who's very well trained, and that's what they have at Crisis Services at the 988 hotline. So please add that number into your contacts. So yearly totals of our Erie County deaths by suicide have fluctuated between 72 and 103 in the past 5 years. And our most recent 2024 data show that 54 confirmed deaths by suicide through the beginning of September. And we want that number to be 0. Suicide is a sensitive topic. Some of that sensitivity stems from the stigma still associated with thinking about suicide, some feeling that is driven by deep grief and trauma that a loss from suicide causes, but failing to talk about suicide, brushing it aside, referencing it as an oblique terms, avoiding the subject is not helpful. I'll leave you with this. As we said, suicide is a permanent solution for a temporary problem. Check on the people in isolation. It does not have to be that way. I'm going to turn to Mark. Thank you.
Thank you, Dr. Burstein. So next I'd like to bring, she is the coordinator of the Suicide Prevention Coalition. Celia.
Good morning. We are here today to raise the flag of hope as we do every year as a symbol to the community that where there is help, there is hope. I do want to start out today, though, with a little story that just came to my attention. Tuesday was actually World Suicide Prevention Day. And in Nashville, Tennessee, I don't know if any of you saw this, but Bon Jovi was doing a promotion on a little pedestrian we're filming. And when he got there was a woman there who was ready to take the step and jump off the bridge. And apparently he spoke with her and was able to get her to step down and to change her mind. That's what this work is like. It's a community all working together. You never know who you're going to run into, in what setting. We had a bus driver a couple years ago who actually helped prevent a suicide. So that's what we're about, being together as a community and taking every opportunity we can to save a life. I'm delighted to have such representation here today from our coalition. We're close to 60 member organizations strong, still growing, and we have also dignitaries, Lisa Shamira from the County Executive's Office, Mike Kashoyan from the County Legislature. Have you here come out to help us get this word out. Over the last year, we've done a few things that have tried to reduce suicide in our community. Special educational programs to reach out to people of color and the Native American community who have high suicide rates. Research shows that access to lethal means actually is one of the biggest issues. Having a quick, easy, lethal method available in your house for an impulsive act is a dangerous thing. Hunting license and their doe tags with a gun lock, a free gun lock. We called it locks and socks. We also gave them a nice warm pair of socks and information on suicide prevention. And we thank the Buffalo VA for their partnership in helping us to get the gun locks, making that happen. That was also partially funded with a grant from the Foundation of Western and Central New York. We've done education at schools. Over 6,000 school staff in Erie County have been trained since this initiative began. This year, we had a particularly fun creative project done with Erie One BOCES at the Career and Technical Center at CalSpan. And here to tell you about it is the principal of that program, Simone Klubeck, who will explain what went on. Thank you. Simone?
Good morning, everyone. My name is Simone, and I am of Career and Technical Education Center at CalSpan, part of Erie One BOCES Career and Technical Education Division. Our new facility is designed with a focus on digital programs, and we're fortunate to offer spaces like a broadcasting suite, a recording arts studio, and open collaboration spaces. We strive to provide the latest technology for our students, and our classroom reflects a modern approach to education. Our mission is to prepare students for career pathways in the global marketplace by providing hands-on learning and post-secondary credits and industry-recognized certifications. We believe in blending academic knowledge with real-world skills and industry demands. At the heart of our work is the belief in meaningful collaborations, both within our school and with our community partners. These are keys to our student success. We see ourselves as a technology hub in Western New York, producing graduates with skills needed to excel in the ever-evolving field of technical arts. Our goal is to nurture each student's creativity and talent, helping them find their voice and use it to share their message powerfully and confidently. I'd like to just bring my students up with me. Today, as we raise the flag of hope, you'll experience a song that truly embodies our mission. Students in Mr. Mark Hunt's video production and recording art staff collaborated to write and record an original song, a long music video that aims to reduce the stigma surrounding mental health, particularly for teenagers. This project, both courage and maturity. The students facilitated focus groups to develop lyrics that are powerful and relevant, and they dedicated time to crafting the perfect melody to complement the sensitive subject matter of their lyricists. The music video not only carries the essence of the song, but also includes a large portion of our student body, reflecting the sense of community behind this project. These students fully embraced our belief that their creativity, combined with their skills in sound recording and cinematography, could send a meaningful message out into the world. Each student contributed their unique strengths, coming together to create something truly special. Before I introduce a student to discuss the project in depth, I'd like to acknowledge a few people who made this project possible. Mark Hunt, student's teacher and Buffalo Music Hall of Fame musician, who brings over 30 years of experience in music and sound recording to the classroom. Dr. Spacone, who generously donated her time and resources to educate our students on mental health, serving as a steadfast resource throughout the project. Bob James, a seasoned musician, Buffalo Music Hall of Fame inductee, and social justice who mentored our students in the songwriting process. And of course, the Erie One BOCES leadership team, wavering belief in and support of my team's message. I'll leave you with this. Talk to our teenagers, talk to our youth, listen to our youth, and collaborate with them, because they will lead the future of where reducing the stigma around mental health ends. Without further ado, I'm excited to introduce one of our talented students, the lead engineer on this original song, Owen Shotwell, to share more about their experience.
Hi, my name is Owen Shotwell. I am now a senior in the video production and recording arts program over at BOCES. On this project back in the spring during our junior year. A big focus in this project was on collaboration. We had all kinds of people from different school districts, different areas, different classes, and we all came together, started in a big room with a guitar and some notebooks, and we came up with some lyrical ideas, came up with some musical ideas, and that was all sorted out. We moved into the studio, which we just got last year, and that was many of the students' first record experience, either at all or in a studio with professional level equipment like able to have over there. And that was my first major project as engineer and producer in that space. So within the song, you'll hear a lot of very diverse musical influences. We have rock, we have hip hop and rap. Our bass player was a gospel musician. So all sorts of things, and I think that really reflects the overall idea and the overall message that we are trying to connect with this song, which is, mental health is a universal issue. It's something that everybody at some point deals with in their life, whether it's themselves or somebody that they know. And it was just kind of our goal to uplifting and far-reaching message that you're not alone. There's no shame in it. If you need help, talk to somebody, because there are people that can help you and want to help you. So we're all very happy to be a part of this bigger thing that kind of extends beyond us as individuals, and we're all very grateful to be a part of the program over at Erie One OCs that gives us the time and facilities and guidance to work on these kinds of projects. Thank you.
Thank you very much.
all that, in time to
You can put the song on now, Rob. We'll do that.
You gotta free your mind, you gotta find your time when you're just feeling down. Look at the friends you found. You gotta free your mind, you gotta find your time when you're just feeling down. Look at the friends you found. I'm trapped in my own mind, bad habits to unwind. I know that I shouldn't, but I'm missing the sunshine. Been missing these blue skies, bad things to realize, but it ain't really real. It's the fake sensations from man-made creations, need reconciliation. I just wanna reach out and call to the station. I know that I need help, but I cannot vocalize. Need to just go and cry, but I keep it bottled. Yeah, I keep it bottled. Yeah, I keep it bottled. You gotta free your mind, you gotta find your time when you're just feeling down. Look at the friends you found. You gotta free your mind, you gotta find your time when you're just feeling down. Look at the friends you found.
Now we know that you're feeling real down. Your depression is real and it's loud. But don't give her no leverage, don't let it affect you. It's better you're seeing it now. Nothing seen is an accident, so don't ask if I'm passionate. I'm exceedingly loud being happiness it has found me in. It's not easy to find an escape. You feel sadness no matter the time of day. But I promise you get through the fight today. Any day you as a happy and we'll find a way and say,
you gotta free your mind, you gotta find your time when you're just feeling down. Look at the friends you found.
Finally, I'd like to bring up Jessica Pirro, the chair of the Suicide Prevention Coalition. Jessica?
Well, good morning again, everyone. We are just honored to be together today to celebrate Suicide Prevention Awareness Month. I first just want to thank all of our partner agencies who are here today. They do the hero's work every day to help people in our community who are struggling with mental health and suicidal thoughts. And I also want to give a special shout out to our team at Crisis Services. Our crisis first responders are available 24 hours a day to help those, their family members, neighbors, anyone who has concerns for others. Our team is there to listen, provide support, but also provide immediate crisis response as needed to help save lives. So I want to thank our team at Crisis Services, our hotline counselors, our mobile outreach counselors, all of our team members who risk themselves to be present every day to help people find hope, safety, and help. So I also just, again, want to thank all of our membership agencies who are here today. Please look at the names of all these wonderful organizations that are here to help you and your loved ones in a mental health crisis, help connect to ongoing support and help. So before we close today, I just want to take a few minutes to recognize one of our members for his work and dedication to our community and the coalition. So Mark O'Brien, if you would join me at the podium. So this will be Mark's, I will say, professional raising of the flag of hope. We told him earlier he needs to come next year, even though he'll be retired. This will be his last raising of the flag of hope ceremony in his role as the Commissioner of Mental Health. And the coalition wanted to thank and honor him for his work. Mark's scope of skill and influence was shared at many places in our community, such as Buffalo General Hospital, Hopevale, and then he began his path to the government sector. He served for Orleans County Mental Health Department, overseeing the provision of mental health, chemical dependency, and developmental disabilities. We were grateful that he made his way to Erie County government and was appointed as the Commissioner of Mental Health in 2020. And what a start to that role, diving into the throes of planning and responding to the COVID pandemic. Starting his tenure at the start of the pandemic was a lot to face, but the needs under his leadership continued, and he was instrumental in responding to the aftermath of 5/14 in 2022. His strength in systems of care and coordination of services has helped our behavioral health community continue to thrive at a time that demands and needs only increase. He has made many achievements as a champion for various efforts, including the development of the Kirsten Vincent Respite and Recovery Center, named in honor of one of our beloved coalition members who is truly missed. Throughout his career, Mark has invested his time, his expertise in supporting others doing this important work, creating and delivering presentations, offering mentorship and teaching. And he also continues to serve our community as a private practice practitioner. Mark has been a huge supporter for the work of the Erie County Suicide Prevention Coalition, providing resources, helping to coordinate this event every year. And we want to thank you for your ongoing support on behalf of the entire coalition membership. And we want to provide you with this recognition, wishing you all the best in your upcoming retirement. Sorry.
I'm not usually speechless, for anybody who knows me. I want to thank Jessica, my colleague and good friend, and the coalition. I'm deeply humbled and deeply honored, and very much committed to the work that you do, and you are the true heroes. Thank you so much.
So just to close us out again, I just want to thank everybody for being here. As shared throughout this press conference, there is help and there is hope. We encourage everyone to take down the Crisis Services hotline number, 716-834-3131, as well as 988. As Dr. Burstein said, put it in your phones. You never know when you might need that to help yourself or somebody else. And I just want to say to our community, we are here. We stand in unity today to let you know that every life matters in this community, and we really want to assure that in your time of struggle, that you're not walking that alone. So please know we're here. And on behalf of the entire coalition, thank you for being here with us today to honor this day and to honor this flag of hope that will fly throughout the month of September. Thanks everyone for being here.
Could you play the song again as we kind of